So thank you. That was really extremely interesting. I have two questions. So you didn't, first question is, you didn't separate out the public finance implications of either of these programs, like how fiscally sustainable they are in a period when economic growth is substantially lower than it was when they were first put into place. And so maybe you could say something about that. And then the second is, if Taiwan covers anybody that is a legal resident, doesn't that create a certain moral hazard problem that a lot of people will just move there when they're old in order to take advantage of the health insurance and then bankrupt the system down the road?
Yeah, well, I'll answer the second question first. And so Taiwan has a very strict immigration policy. So even if you marry a Taiwanese man or woman, you don't necessarily get the residency. And for people to work in Taiwan, they have to go through the process of applying for the legal working permit. That one is hard too. And so Taiwan, actually the government has been criticized for not opening up the immigration policy, so there's a brain drain because our average wage rate has not been increasing at all for the past 2 decades. So a lot of people, they actually work outside Taiwan. And so the benefit only will extend to sort of overseas Taiwanese. And those are the people who have legal citizenship, so they can always come back to Taiwan anytime they want. And so that has created...
Have they been paying?
Oh yeah, they have to pay. And actually they have to pay starting 1991. So if you have never paid any premium before, you have to pay starting 1995, the year we start the program. So they have to wait. Exactly. So they have to wait, like, how much costs, you can afford. And if it's really serious disease, definitely. So these days people, a lot of people actually who live outside Taiwan, they pay. And because they are not formally employed, so therefore they can enroll the program through this household registration system where the government actually subsidizes 40% of the premium. And so it's not a bad deal. So they pay anyhow. Some of them are obnoxious enough to just pay on the day they arrive and then cancel the plan when they leave after they have care. And so but those are really small number of people. And in terms of public finance, before 2013, before the government was able to increase the premium, in the 20-year history of national health insurance in Taiwan, the government was only able to increase 3 times in terms of premium. Every time it's a big political fight, and then it will cost at least 1 health minister. So the rotation rate is very fast. And before 2013, the program is running deficit. And so that has created a lot of problem. And so for the government, and you don't have enough revenue coming into the pool, and increasing premium is almost impossible. Like I say, there's always a political fight. So the insurance program definitely suffer a lot. And so what they do is they cut corners. So providers was furious. They always, have to, they want to negotiate with the government, but there's no way because the government say, this is the much money I have. So the public finance is some issue. But what I'm looking at is only 6 years after that. And the reason is that we really want to tease out the noise. So we just want to look at, the impact of having an insurance, national health insurance, right on space. But if you look at like 10 years, 20 years, that there will be a lot of noise. It depends on the the social environment, and we try to avoid that. So just 6 years after that, so that insolvency issue doesn't come into the picture. It does affect South Korea a little bit because in year 2000, but that's also outside of so 6 years after the program, again, the insolvency problem doesn't come into the picture for South Korea either. Although South Korea, because their economy has been doing good, so they were able to increase the premium whenever they want. So one time they were invited to Taiwan, there was like joint meeting. So we were asked them like, what do you do if you run out of money? And the head of the NHI Corp just said, just increase the premium. What is so difficult about that? And we were like, well, lucky you. We don't have the luxury. I mean, essentially people work on street protesting, and the legislation would not pass it. So because they are afraid, once they know they are the one who vote for them, they're going to lose their vote. So election, so I guess if there's a upcoming election, it's good and bad. The bad thing is you won't be able to do any reform impossible because they don't want to offend people. The good thing is they probably will try to buy the most by giving out more of the benefits. So good for good and bad. Yeah.
Yeah, Richard, in the United States, the biggest challenge for healthcare is the premium. Okay.
Yeah.
So as you mentioned on your presentation, you said the 1/3 of the budget actually comes from the government.
Yeah.
And so in the year run, and is that is it deficits or it's self support? Can like in the United States, the affordable care, and California is the biggest state to adapt the program, and then in the first year, the government said, okay, the year 2015, and every state will be self-support. Mm-hmm. But even up to now, it's still the arguable because the federal government support that. So for the program in Taiwan, and if it's run in deficit, who pay for it? Is that the government pay for it, or?
No. What happened was in the years when they have a deficit, they actually have a deficit. The reserve was completely depleted in year 2007, and so and up till they were able to increase the premium again, that was 2013. And so for that period of time, they were running deficit. So what they do is they borrow from the bank. And because the interest rate was so low, the bank was so happy to loan the money to NHIA. So they borrow the money at the beginning of the month, and when the premium come in, and then they pay the loan. And so they were always on the short-term loan until 2013 when we started this dual-track premium collecting system. Yeah. Now NHIA is sitting sort of comfortably on this handsome amount of reserve, because of this dual track. So, and that's why, actually, then they decrease because of the foreseeing presidential campaign last year. So the government then actually decreased the premium contribution rate a little bit. But, the money will be depleted pretty soon if they keep doing that.
So you mean that right now the system has a surplus?
Oh, yeah, the reserve, sizable reserve. They sit comfortably on that sizable reserve. So the head of NHI does not have gray hairs of the previous ones.
My understanding in the United States is 10% of your income mm-hmm. spent to the Medicare or the health care. But your presentation, one area you say the individual company, they pay 10%, but the other pay 4.91%. So how much premium?
4.91%. No, the 4.91 is the premium contribution rate is assessed on your payroll, and then normally the employer, take me for example, my employer will pay 35%, and government pay another 35% because I'm a university faculty, and I pay 30%, and the share of the premium really varies according to your occupation category. And so it's a very complicated system. And the only category the government does not provide any subsidy is the self-employed one, because you are the boss yourself. Therefore, the government is not paying for it's not subsidizing your premium. Even for labor worker, 10% from the government.
I haven't heard from you talk about the long-term care. Would that include in the universal?
No, it's a separate issue, and actually it will pose very sort of a big threat on our insurance system. It's going to cost a lot of money. So far we just passed the law for Long-Term Care Service Act, not yet the long-term service insurance. So this will be a daunting task faced by the incoming health minister, and he said he's going to implement that.
The United States passed a law called the Class Act. Mm-hmm. Okay. Community living assistance provide service service provide. Anyway, it's Class Act. Okay, that means that the in the community everyone can contribute certain hour to help the senior, and then at the time you getting older you can get it back.
They call it the bank.
So the same system in Taiwan?
Yes, they are talking about it. They have been talking about it. I mean, various sort of options are already surfacing. but there's not a sort of, I mean, I think they are exploring. They are exploring still. I mean, that obviously would be an important issue because the elderly accounts for 12% of the total population now. And it's going very fast because our fertility is really low. It's just around 1. So it's way below the replacement rate. It's not the replacement rate for decades. So that would be a challenge. I mean, not even my students will have children. I mean, even if they are married, they don't decide not to have children because it's so expensive. I mean, I can tell you, I'm a mother of 3. I can tell you how expensive that can be. Yeah. You have to sacrifice a lot.
Last question. What percentage of the national budget, like in the United States, they have the 22% for the federal budget spent on the health care?
Oh, I see.
Yeah, how much?
I don't have that. I don't have that figure. First of all, I think it will take some calculation because some of the money actually show up in social health insurance, but it's from the government. By law, these days, Taiwan government are supposed to pay no less than 36% of total national health insurance revenue, no less than 36%. And so if you take that into account and then all the other health spending, so that one takes some calculation. I don't have the answer for that, sorry.
Okay.